The environment plays a crucial role in healthcare, influencing a wide range of health outcomes and public health practices. Here's a detailed look at how the environment is associated with healthcare and how epidemiological studies address environmental factors to assess and control public health. Association of environment with healthcare. Air quality, pollution, exposure to pollutants such as particulate matter, PM 2.5 and PM 10, nitrogen dioxide, NO2, and sulfur dioxide, SO2, can lead to respiratory diseases, cardiovascular conditions, and other health issues. Indoor air quality. Poor indoor air quality, often caused by mold, tobacco smoke, and volatile organic compounds, VOCs, can lead to respiratory problems and other health issues. Water quality. Contaminants. Contaminated water sources can spread diseases like cholera, dysentery, and other gastrointestinal illnesses. Sanitation. Lack of access to clean water and proper sanitation facilities can result in widespread health issues, particularly in developing countries. Climate change. Heat waves. Increased temperatures can cause heat-related illnesses and exacerbate pre-existing health conditions. Vector-borne diseases. Climate change can alter the distribution of vectors such as mosquitoes, leading to the spread of diseases like malaria, dengue fever, and Zika virus. Chemical exposure. Toxic substances. Exposure to chemicals like pesticides, heavy metals, and industrial pollutants can lead to chronic health conditions, including cancer and neurological disorders. Built environment. Urbanization. Poor urban planning can result in inadequate housing, lack of green spaces, and limited access to healthcare facilities, negatively impacting health. Transportation. Traffic pollution and accidents are significant health hazards associated with poorly managed transportation systems. Role of epidemiological studies in addressing environmental health. Epidemiological studies are essential for understanding the impact of environmental factors on public health and developing strategies to mitigate these effects. Here's how these studies help. Identifying associations. Epidemiologists use observational studies, cohort, case control, cross-sectional, to identify associations between environmental exposures and health outcomes. For example, studies might track asthma incidence in relation to air pollution levels or investigate the link between contaminated water and gastrointestinal diseases. Assessing risk. Epidemiological research quantifies the risk of health outcomes associated with specific environmental exposures. This involves calculating relative risks, odds ratios, and attributable risks to understand the magnitude of the problem. Monitoring and surveillance. Continuous monitoring of environmental health indicators, for example, air and water quality, and health outcomes helps identify trends and emerging threats. Surveillance systems, such as those for tracking disease outbreaks related to environmental factors, provide critical data for public health interventions. Informing policy and interventions. Findings from epidemiological studies inform public health policies and regulations aimed at reducing environmental risks. Policies might include regulations on emissions, standards for water quality, and guidelines for safe chemical usage. Public health interventions. Epidemiologists design and evaluate interventions to mitigate the impact of environmental hazards on health. Interventions could range from community-based initiatives to reduce exposure to pollutants to large-scale public health campaigns promoting safe drinking water practices. Health Impact Assessments, HIAs. HIAs are systematic processes used to evaluate the potential health effects of a project or policy before it is implemented. They consider various environmental factors and provide recommendations to enhance positive health outcomes and minimize negative impacts. Practical examples in healthcare and epidemiology. Air quality and asthma. Epidemiological studies have linked air pollution to increased asthma attacks. This has led to stricter air quality regulations and initiatives to reduce vehicle emissions in urban areas. Water contamination and gastrointestinal diseases. Outbreak investigations and long-term studies have established connections between contaminated water supplies and diseases like cholera. This has driven efforts to improve water treatment infrastructure and sanitation. Climate change and vector-borne diseases. Research on the effects of climate change on vector distribution has informed public health strategies, such as mosquito control programs and public awareness campaigns in areas prone to diseases like malaria and dengue. By integrating environmental health data into epidemiological research, public health officials can better understand the complex interactions between the environment and health, leading to more effective strategies for promoting and protecting public health.